As of December 2023, 334 and 95 people in Ghana were counted as living with human immunodeficiency virus. HIV is a virus that attacks the body's immune system. The virus targets the body's white blood cells, weakening the immune system. Valentine or Chocolate Day is normally associated with alcohol and sex, which could lead to sexually transmitted infections, including HIV. Condom use is one of the many interventions initiated by the National HIV and AIDS Control Program of the Ghana Health Service to reduce HIV transmission among the populace. With the celebration of Valentine Day event, the Ghana News Agency captures public perception on condom use as a measure to keep individuals relatively safe from the disease.
We know condom it helps in preventing infections. All right, so if we use it more, I think it's going to help prevent more infections. I have only one partner, so I use condom when I think I want to prevent pregnancy, but not for infections.
I'm living with someone that is willing to stay with me, and I'm not used to condom. Why? Because I don't go out to dating people. No. I just stay at one place.
Yeah, no ma, yeah, Christopher, yeah, condom, there, yeah, you should condom. Yeah, that's it. We know about I say who person what's in it, then I say who didn't know.
For me, like this, I'm dating. Me and my partner, we check every 3 months for HIV and other sicknesses. So we are good to go. We don't use condom.
Dr. Stephen A.C. Addo is the program manager of the National HIV and AIDS Control Program.
Last year, I reported that we had identified more than 35,000. By the end of the year, it was more new infections, which means that no matter what we are doing with treatments, people are getting infected. 2023, an estimated 18,000 people or so were newly infected. And if these statistics continue, it means that very soon our prevalence will start going up. We've been a country of low prevalence, less than 2%. And we have to keep it like that. But if we get complacent, we will then be surprised. And the only way we can prevent all this is to intensify our education on prevention. The principles of prevention still hold. The first is abstinence. And it's very relevant for different population groups or stakeholders. By a certain age, people have started having sex. So we can talk about something. But for those who don't need to have sex, or those who can abstain, the young people and all that, delay in early sex is very safe, it's important, it's useful. So we also have to promote abstinence among stakeholders or populations who need to abstain. Because people keep saying that there are various reasons why we don't have to talk about abstinence again, it's not possible. No. There are people who can abstain. People who have abstained and it saved them a lot of STIs. So for the youth out there, abstinence is key, and that is the first. To save you from sexually transmitted infections, from HIV in particular, from unwanted pregnancies, and all the associated complications for fertility. Now, being faithful is key. That's the second, the B. And that is being faithful to your partner. Multiple sexual partners increase the risk of HIV transmission. So if you stay with one partner, it's safer. The two of you are negative. You only exchange negative, nothing positive, because there is no virus. The C is condom use, and it's very important, because that is the only, by far, very effective barrier. We have introduced PrEP, which is pre-exposure prophylaxis, which is using medications. But to date, condom is a physical barrier to infection. And when we talk about condom, it's the use of this latex material, which is tried and tested and certified for use all these years and is proven to be effective. It's resilient and able to resist any shocks and easy tears unless it is expired. So every condom that must be used must not be expired, and everybody must check well. The second principle is that it must be used correctly, consistently, and continuously within an act. Correctly means that it must be used on an erect penis, and it must not be used double. It should be single, not double for double protection, because that's going to cause other friction between the two. And just after utilization, and there's ejaculation. And when now there is a resting, it must come out, because if you do not remove it deliberately and dispose of it, it will naturally get out and to still get into the woman. And we've seen cases where people have used condoms, but the condoms ended up getting lodged in the female reproductive tract. And then once there's a lodging, there's a spillover, and then you come back to square zero. So it must be used correctly. It must be used consistently within an act and continuously. Continuously means that if I meet you and you are not my regular partner, or you are informal, you are a stranger as far as I'm concerned. So any new person, you don't know the person's status. It's better to be safe and use condoms.